Hi, Eileen Veilleux, the fam here. Welcome to another installment in our mini mental health series. And in this installment, we are going to be covering capgras syndrome, which is the weirdest brain disorder ever. Before we begin, let me just remind you to please watch the full video because in the video, there'll be three key words. When I get to the three keywords, I will say keyword and what the keyword is. At the end of the video, in the comments section, put down what the three keywords are, along with the genuine comment about the video to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's begin. What is capgras syndrome? Well, capgras syndrome is a psychological condition. It's also known as impostor syndrome or capgras delusion. People who experience this syndrome will have an irrational belief that someone they know or recognize has been replaced by a keyword, impostor. They may, for example, accuse a spouse of being an impostor or their actual spouse. This can be upsetting for both the person experiencing the delusion and the person who is accused of being the imposter. In some cases, the person experiencing the delusion may believe an animal, object, or even a home is an imposter. Capgras syndrome can affect anyone, but it's more common in women. In rare cases, it can also affect children. So what causes capgras syndrome? Do we know? Well, capgras syndrome is most commonly associated with Alzheimer's disease or keyword dementia. Both of these affect memory and can alter your sense of reality. Schizophrenia, especially paranoid hallucinatory schizophrenia, can cause episodes of capgras syndrome. Schizophrenia also affects one's sense of reality and can cause delusions. In rare cases, a brain injury that causes cerebral lesions can also cause capgras syndrome. This is most common when the injury happens in the back of the right hemisphere, as that's where our brain processes facial recognition. People with epilepsy may also experience capgras syndrome in some rare cases. Now, there are several theories on what causes the syndrome. Some researchers believe that capgras syndrome is actually caused by a problem within the brain, like atrophy, lesions, cerebral dysfunction, just to name a few. Some believe that it's a combination of physical and congenital changes in which feelings or disconnectedness contribute to the problem, while others believe that it is a problem with processing information or an error in perception, which coincide with damaged or missing memories. So you see, it's not quite there on what causes it. There's so many things that scientists think could cause it, but we do know that it is associated with some mental disorders, but not always. So how do you treat capgras syndrome then? Well, right now there is no prescribed treatment plan for people with capgras syndrome because more research needs to be done. But there are treatment aims to address the underlying cause. For instance, if someone with poor symptom control and schizophrenia experiences capgras syndrome, treating the schizophrenia can improve the capgras syndrome. However, if capgras syndrome occurs during the course of Alzheimer's disease, the treatment options are limited. The most effective treatment to create is to create a positive, welcoming environment where the person affected feels safe. Some care facilities will use keyword validation therapy. In validation therapy, delusions are supported instead of rejected. This can reduce anxiety and panic in the person experiencing the delusion. Reality orientation techniques may be helpful in some circumstances. This means that the caregiver gives frequent reminders of present time and location, including reminders of major life events, moves, or any substantial changes. Now, the underlying cause of capgras syndrome will be treated as much as possible. These treatments may include medications like cholinesterase inhibitors, which boost neurotransmitters involved in memory and judgment for dementia and Alzheimer's disease. Antipsychotics and therapy for people with schizophrenia, and surgery if possible for brain lesions or head trauma. So how do you care for somebody that has capgras syndrome? Well, caring for someone with capgras syndrome can be emotionally demanding, especially if you're the one they perceive as an impostor. To help someone with capgras syndrome, here are some strategies to try. Enter the realm of reality when possible. It can help if you try to understand how terrifying it must be for them. Don't argue with them or try to correct them. Do what you can to make them feel safe. If you're unsure what to do, you can ask them what they need. Acknowledge their feelings. If possible, have the impostor leave the room. If this is you and you are the caregiver, let someone else take over until the episode is over if you can. Rely on sound. If you know someone is prone to capgras syndrome, you can make sure the first way they register your appearance is with sound. Greet them out loud before you see them when possible. So that's how you can deal with it. There's not much else you can do. Like they said, most of it's associated with dementia and Alzheimer's. Sometimes it's schizophrenia. If you're the caregiver, though, like they said, always speak before you enter. I remember when my late husband when he had his seizures. And when he had his brain surgery, they had him on so much heavy morphine. And when I went in to see him, he didn't recognize me the first time. And that's where I learned from the doctors, because I was quite upset. Like they said, it's upsetting for both of them. At that time, because it was a brain tumor, it was a lesion on his brain. You know, the tumor was pressing on that part of the brain where recognition is. So he didn't recognize me as his wife. I had to go. Of course, it upset me. It brought tears to me because this is my husband that I've been with for so many years. And the doctors explained to me, and they told me when I go in the room, before I enter the room, you know, to speak. Kind of open the door where he can't see me yet and start talking, and then enter while I'm still talking. And that did help out because when I went back in, I kind of stood behind the door and opened it, and I started talking to him and everything. And as I entered the room, at that point, because he recognized my voice, he did recognize me. So that does help. That's it for this installment on capgras syndrome. But now you understand why it's the weirdest brain disorder ever. Um, Before I leave, I want to just remind you to always see with your heart and not your eyes, because what your eyes see truly isn't important. What matters is invisible to the eye, because only the heart can see it. And when you see with your eyes, you hurt people. You don't think what you're saying can be hurtful, but we're not walking a mile in somebody else's shoes. So even the littlest joke can hurt some people, depending on what they have. So it's easier to see from the heart and take that into consideration before you open your mouth and speak. Because when you see with your heart, that won't happen. You won't, you'll know if a person can handle a joke, or you'll have a better understanding of that person. So remember, I'm talking to every one of you out there. Yes, I see you and I love you for you, because every one of you were uniquely made and created differently. And we're all put here for a purpose. So remember, until we see each other again, I love you. Bye.